We were speaking about the general anastomosis about the lower limb. That means from the hip joint itself, we were speaking about the anastomosis, because this is the concept from back of the thigh. What are the muscles we have seen? So the anastomosis actually from the hip region. So we had trochanteric anastomosis, then cruciate anastomosis, then hip region. We have totally 3 anastomosis. The same way, when it is crossing the popliteal region, it has separate supply from that region also. The point is, external iliac artery, that is continuing as femoral artery, when it is reaching the popliteal region, it transforms itself into popliteal artery, and when it is entering into the popliteal fossa, it has multiple anastomosis. For that anastomosis, it transforms itself into genicular arteries. The genicular artery, mainly it is crossing in the center, mainly the posterior side, it is crossing in the center, and superiorly it gives 2 sides branches, inferiorly it gives 2 sides branches. That means this is the total popliteal fossa. Here center we have middle portion we have middle genicular artery. In the superior portion we have superior genicular artery. Inferior region we have inferior genicular artery, and superior plus inferior both sides we have left and right. That point is, so it covers the entire surface of popliteal region. So popliteal region is here, so it covers the entire surface both to the left side as well as to the right side, and most probably the left side will be having more accumulation of arteries as well as nerves or nerve branches, everything. That's why we say generally for sciatic nerve as well as for the back of the thigh, generally we say the medial side is most dangerous side than the lateral side. Okay, because we have lots and lots of neuronal branches also there, plus arterial branches also there. So we have lots of things to supply. And anastomosis, we have lots and lots of anastomosis. See, when you go for example, when you go for injection, having an injection, they place that injection in the gluteal region, especially they select the area which is superolateral. In that area only, the branches are little bit less, the anastomosis and the branches or arteries are little bit less there. So we won't puncture that much, right? So we select that area. Okay. So this is about the genicular anastomosis. This anastomosis plays an important role, because this particular part in popliteal fossa, it is necessary for the functional capacity also. See, this is not about stability. When it is in the back of the thigh, entire back of the thigh, we can stand, but the point is there is no what you say. For example, I tell you like this. This is knee joint. You are able to flex it. You are able to extend it. We have anterior wall and posterior wall. In that we have fat pad also. So that gives some cushioning effect to the anastomosis sides. That means the arterial, and inside we have vein also there, artery is there, then tibial nerve is there. In the lateral side we have common peroneal nerve also is there. So all these structures should be in a safer zone. So we have fat deposition. So we can flex, we can extend. There should not be any damage. So it is, the meshwork is actually descended according to that. The same way, when we are in flexion also, there should be blood supply. It's like when you are actually flexing your knee, there is no blood supply. Just imagine what it will be, how it will be. When you are extending, again the blood supply is forming, right? That is not right, right? So when you are flexing also, you should have proper blood supply. It should not compress any area. So we have proper meshwork which is covering the entire popliteal region, to the left, to the right, to the middle, the separate genicular artery, middle genicular artery, plus inferior side also we have 2 separate arteries which is covering the lateral as well as the medial. That means which is going to supply to the medial gastrocnemius, and which is going to supply to the lateral gastrocnemius. So when we are flexing the knee joint, the upper gastrocnemius surface, that is also little bit bulk. The lower popliteal, I mean the lower part of upper thigh. So there also we have little bit bulk. So both should not get compressed. There should not be any compromisation, right? So because of that, if suppose these two are compressed and gets compromised, we have middle area, middle genicular artery that supplies the both areas. Plus the point is it have multiple twigs. It corresponds to the anterior, postero-anterior side also. From there also it is producing lots and lots of arterioles.